An infographic released by Cape Town's Groote Schuur Hospital on Monday highlighted the difference in the number of vaccinated and unvaccinated COVID-19 patients admitted. At the time of the 156 hospitalizations, 153 were unvaccinated. There were 66 patients in high care, none of them were vaccinated. 32 were on ventilators, all unvaccinated. The Western Cape Health Department says it's currently preparing similar data for the rest of the province to give a bigger picture. It also confirmed that it's not fake news, as some people were peddling yesterday. Professor Marc Mendelson is the head of the Division of Infectious Diseases and HIV Medicine at Groote Schuur and has seen these results with his own eyes. He joins us now. Professor, thank you so much. Yesterday, some people were questioning the veracity of the infographic that was released and were saying it looked just like one released by an American hospital group. Was that a coincidence?
Look, I think what it shows is what we're seeing internationally. We're seeing that unvaccinated people are predominantly those that are getting severe COVID, and those that are vaccinated are being protected against severe COVID, hospitalization and death. And therefore, the people that we're seeing in our hospitals are largely unvaccinated. Now, no vaccine is 100% effective, so there will be cases of people who are vaccinated that do come to light who do get severe disease, and unfortunately some will pass. And as we move in South Africa to a much larger percentage of the population who are vaccinated, obviously by probability that's also going to increase slightly. But at present, overwhelmingly, in our high care units and our intensive care units, the patients are unvaccinated.
Prof, when doctors in high care and ICUs speak to these patients who are undergoing intubations and, ventilation, do they have regrets for not getting vaccinated?
Look, it's very variable, because there are some people on the wards who are unvaccinated because they weren't in an age group even yet that were able. I mean, we've had some really tragic young people, even under the age of 20, who are dying. And then there are some who, have been on the ward quite a long time, who are, again, missed out. But there are people, yes, who are of an age group where they were able to get vaccinated. And yes, it's heartbreaking, actually, to be with a patient who is filled with regret. And I mean, the psychological impact of having COVID and then being in high care wards in particular is extreme. And so that just adds into the anxiety and the psychological problems that some of our patients are finding.
Some of the doctors I've spoken to at both private and public hospitals say that when they do admit patients who've not been vaccinated, they do their job, and obviously they want to save the life, but they also feel slightly, I'd say, ambivalent about the fact that the patient hasn't been vaccinated and they're taking up a bed when it could have been avoided.
Look, prevention is always better than cure or any treatment, and we really hope as a health workforce, both in South Africa and obviously internationally, that everybody will take the opportunity to get vaccinated, because what we're really trying to do is what the vaccine does, and that is protect you against severe COVID, hospitalization and death. That's primarily what this vaccine is doing. And so, missing that opportunity is very tragic and, shouldn't be taken lightly. Any patient who comes to hospital is a patient, and we, are here to provide clinical service and care to everybody, whether they're vaccinated or unvaccinated. But you are dealing with a very, very tired and traumatized workforce. And so clearly these sort of discussions do come into it. But, at the end of the day, we are here to serve everybody, irrespective of whether they are vaccinated or not. We just urge people to get vaccinated to protect themselves.
Last question before we go, Prof. Have you noticed that there are fewer people in high care and in ICU since our vaccination drive has been ramped up?
Well, the problem, of course, is that, that we haven't vaccinated enough people yet to really have seen the effect of that. It's at the moment we're just coming down, hopefully off the peak of the third wave, and our high care units, depends on how many people are coming into hospital and how you have to prioritize. But at the moment, there are still many people coming into hospital that actually require high care and ICU. So, we're not there yet where we're seeing so few, and we can make that sort of calculation. But we really need to see far more people in the population vaccinated to really answer that question. And unfortunately, at this level, we're not almost completely unable to stop a fourth wave, at least.
All right, thank you so much for all your dedication. Professor Marc Mendelson is the head of the Division of Infectious Diseases and HIV Medicine at Groote Schuur Hospital in Cape Town.